In this video, we're going to be talking about your options for healthcare coverage. Everyone needs healthcare at some point in life. If you have healthcare coverage, you can access hospitals and medical services when you need them. Most health insurance will cover mental health and substance abuse treatment too. The information covered in this video is specific to California, but similar benefits are available in almost every other state. If you're not in California, you can find information for your state by doing a web search for your state and healthcare coverage. First, we're going to talk about Covered California. Covered California is an online healthcare marketplace where you can sign up for healthcare coverage online, by phone, by mail, or in person. This online marketplace is a website where you can shop by choosing a healthcare plan, and you can also compare various plans' prices and benefits. Other states will have their own healthcare marketplaces with their own names. Each healthcare plan must cover essential health benefits like doctor visits, hospitalization, emergency care, maternity leave, pediatric care for children, and prescriptions. Through the Covered California application process, you can also find out if you're eligible to get federal tax credits to reduce your healthcare costs, or if you're eligible for free or low-cost healthcare coverage through Medicare. To get healthcare through Covered California, you must be a California resident, lawfully present in the United States, aged 18 or older, and not currently incarcerated. Based on your household size and income, your family may qualify for financial assistance to help you afford healthcare. By submitting a Covered California application, you'll find out exactly what kinds of assistance you can get and how much. If you're planning to buy a private healthcare plan from the Covered California marketplace, you have to enroll during the open enrollment period to get coverage for the following year, unless you qualify for a special enrollment period. You can apply for Covered California through several methods: online, by phone, in person, by mail, or by fax. You can get the paper application at your local county social services office or online at the site that's shown on the screen. You might find out from applying on Covered California that you're eligible for Medi-Cal. Medi-Cal is California's Medicaid program, offering free or low-cost health care coverage for low-income California residents. If you live in California, you can qualify for full Medi-Cal coverage in a few different ways. First, you may be eligible for Medi-Cal if you're a California resident or you're lawfully present in the U.S. and you have limited income. Second, you may be automatically eligible for Medi-Cal if you meet the income requirements or if you fall into one of these special categories, and those are adults age 65 and older, blind or disabled individuals, children that are under the age of 21, pregnant women, women who've been diagnosed with breast or cervical cancer, parents or caretakers of disadvantaged children that are under the age of 21, residents in skilled nursing or intermediate care homes, and all individuals who are enrolled in certain other public benefits programs. So those include CalWORKS, SSI and SSP, Refugee Assistance Program, in-home supportive services, foster care, or adoption assistance program. Now let's talk a little bit about Medi-Cal benefits. As required by law, Medi-Cal covers a set of essential health benefits. Those include hospital care and emergency services, medical services, prescription drugs, mental health and substance abuse treatment, potentially including treatment that's a condition of probation or parole, maternity and pediatric care, rehabilitation services, preventative care and chronic disease management, and even some dental care. You can apply for Medi-Cal by submitting a Covered California application through the many methods that we talked about before. Now let's talk a little bit about private health insurance. If you don't qualify for Medi-Cal, you'll either have to purchase insurance yourself, or you'll possibly have an option to get subsidized coverage through your employment. It's important to consider a few things carefully when you're choosing which plan is best for you. First, whether the plan is an HMO or a PPO. An HMO will require you to identify a primary care provider or doctor and receive a referral from that PCP for any services that are received from a specialist. HMOs are generally less expensive, and so that's why there's a trade-off there. A PPO allows you to make an appointment with any provider that's within the coverage network, but again, they're usually a bit more expensive. Second, you'll need to think about whether a provider you already have and like is covered under the plans that you're looking at. If you already have a provider that you want to continue to receive care from, find out if that provider is covered by the different plans that you're considering, and that might help you to make your decision. Next, let's talk briefly about Medicare. Medicare is a federal healthcare program for people who are elderly and people who have disabilities. If you're a citizen of the U.S., or if you've been a legal resident for more than 5 years, you may qualify for Medicare if you're age 65 or older, and you or your spouse has worked and paid into Medicare for more than 10 years, or you have a disability that qualifies you for Social Security disability benefits. You can also qualify for Medicare if you have permanent kidney failure that requires dialysis or have had a kidney transplant. Medicare covers services and supplies that are medically necessary to treat a disease or condition. Finally, there are also free and low-cost clinics all across the county. In an emergency, it's the legal and ethical duty of every emergency room to provide emergency care regardless of ability to pay. However, there are also free clinics that will provide service to those with low incomes. In the South Bay, you can visit Harbor Free Clinics, the South Bay Family Healthcare Center, or the Wilmington Community Clinic, for example. Healthcare coverage is an important part of looking after yourself. Take time to make smart decisions and make sure that you're covered. Let your coach know if you have any questions, or seek suggestions and help from trusted peers and family members. Thank you.